Hi, I'm Dr. Donovan from thedispensarionline.com. I've seen in my practice a lot of young patients who have hypertension, high blood pressure, and always inquisitive as to why so young they would be getting hypertension. Some of these cases are patients who are triathletes or marathon runners, and yet they're 28, 32, and they have hypertension. And then when I evaluate them further and look at their lipid levels look okay, but their homocysteine is elevated. Homocysteine is a metabolite in our body. And when that metabolite starts to elevate in our blood, it can become a major cause of cardiovascular disease, hardening of the arteries, if you will, or atherosclerosis. It's one of the major non-lipid risk factors for heart disease. Now, why is that important, and how does that relate to hypertension in young people? There is a genetic polymorphism. A genetic polymorphism is a genetic piece that's kind of gone awry, probably the quickest and easiest way to understand that. And that genetic polymorphism is called methyl tetrahydrofolate reductase deficiency. So you have a gene, and it helps you, or dictates to your system how you should methylate certain molecules in your body. Folic acid, B12 primarily. And if folic acid and B12 aren't methylated correctly, your homocysteine levels go up. As your homocysteine levels go up, your risk for cardiovascular disease goes up. Now, what I didn't realize until earlier this year is that this polymorphism is much more present than we ever thought in our population. Roughly about 10% of our population will have this polymorphism. But when I started screening my patients with hypertension under the age of 35 or 40, when that hypertension was beginning in their 20s and 30s, I screened them for the polymorphism after looking at their homocysteine levels and finding them elevated. Sure enough, they had the polymorphism. But that polymorphism is now shown to be related to hypertension as well. So, how do you treat that polymorphism? Well, studies show that giving high doses of folic acid and B12 can be helpful in bringing down the homocysteine eventually. But you can keep pouring in high levels of B12 and folic acid, but if you're not methylating them well enough, all you can do is sort of push the max that enzyme system will give, and it isn't really enough. So you need to use a different form of folic acid and B12. They're methylated forms, so you need to use methyl tetrahydrofolate and methyl B12. These forms of B12 and folate are already past this block that you have, this genetic block. And so they can be more helpful. Now, why is that important? Because these specific B12 and folic acid molecules will help bring down the homocysteine, will help prevent multiple problems from occurring that are associated with this polymorphism. Those are neurological deficits, heart disease, and even some cancers. So it's important to catch this polymorphism early. 10% of the population has it. It's a common cause of early hypertension when all other factors have been evaluated and ruled out. And it's an early cause of elevated homocysteine levels in patients. So those are some of the ways you can discover if you may be at risk for this polymorphism. And most likely in your family history, you're going to see mom, dad, grandma, uncles, grandpas, whatever, with early heart disease, maybe even heart attacks in their 40s or 50s. So if that's what is happening with you, family history of early onset cardiovascular disease, strokes, heart attacks, early onset of different cognitive and neurological problems, and you're in the age group of 18 to 40 and you already have hypertension and you don't understand why and you've been evaluated for it, better get your homocysteine levels looked at. If they're also elevated, then you may be looking at a methyl tetrahydrofolate reductase polymorphism. And if that's so, then what you need to be taking is not just over-the-counter folic acid and B12, but the methylated forms. Thank you.